thanks a million. And thanks everybody I always thank you in advance for your attention, which is probably me maybe being overly optimistic that I definitely have your attention for the next 15 minutes. But thanks a million to introduce myself. Look, my name is Lorcan Nine. I'm the head of training careers to communications clinic. To give you an idea, I suppose, of what's relevant in that and what I'm going to be talking to you about today, a lot of my life will be helping people around their media profile and media training. So be it direct media training that, look, you're going on TV, you're going on radio, and you need to get your point across, or more long term of, look, in 12 months time, how do you want to be seen? How do you want to be thought of? Linked into that then consistently is people's online brand or their personal / professional brand. How are you perceived? How are you seen? So I'm hoping in the next 15 minutes to get across just a couple of kind of thought processes you can go through that you can use to help make decisions and help channel yourself so that you are building that most professional brand as possible online. And then, look, I'll take any questions at any stage as well. Throw yourself off mute and ask me a question. Fight with me at any stage over the next 15 or 20 minutes as well. Even if it's just, Lorcan, the accent is regional and I'm not used to it. Could you repeat what you said there, or you're going too fast? I'm not precious. Fight with me at any stage as we go through what we're talking about. So look, to start off, just I suppose to define what that concept of a brand actually is, because if you Google it, you're going to get different versions of what your brand is. The most common quote that comes up is from Jeff Bezos, who would say, your brand is what people say about you when you're not in the room. Now, I would push back against that, okay? Your brand isn't just what people say about you when you're not in the room. It's what people think of you. The not in the room, particularly in an Irish context, makes us go quite negative pretty quickly of geez, what are they saying about me when I'm not here? While what your brand is actually is when somebody thinks of you, if they were forced to write down 2 or 3 terms that come to mind when they think of you, what would they write down? It's as simple as that, and that can be positive, neutral, or negative. It could be very hard working, it could be insightful, it could be progressive, it could be, probably works, is very talented, but geez, maybe they could work harder. There are lots of things that could come to mind, but that's what your brand is. And everything you do online and people who follow you online and interact with you online, they're slowly building up a brand of you from everything you do. And every tweet you send, every video you put up, every time you reply to somebody, every Facebook post you put up, you're either building or unbuilding a positive or negative brand. So that's the way you need to think of it. Everything you put up is either making it slightly better, slightly worse, or changing it to something you want it to be or not, or don't want it to be. And that's how you need to be thinking of your brand. What do I want the people who are engaging with me to write down? If I was to say, what words would you like them to write down about you? What would those be? And that's ideally what you would like your brand to be. And look, it matters. How people perceive you matters. I think perhaps it shouldn't. For the most part, sometimes it should just be the work standing for itself. But we all know that perception matters. It changes how people engage with us. It changes how people view us. But it also changes how people process your research and process your insights. So the simplest example of that idea of, if you think of everybody who engages with you as wearing a pair of tinted brand glasses, is that we don't watch people through clear glasses. There's a little tint of a color of the glass they put on to engage with your work. And you're trying to tint that glass the right color, I suppose, of the color you'd like it to be. So, the simplest example, if we take the thankfully former president of America, Donald Trump, there have been a lot of research done into what his brand for his supporters was. Now, he has a lot of negative brands for his non-supporters, but for his supporters, a lot of work put into that. They all saw him as a winner, but as a specific kind of winner, in that when he wins, somebody else loses. So you don't have to agree with that brand. It's not a brand I would agree with, but he established that for his supporters. And that's why he got away with as much as he got away with, because that's what he was assessed against. That's what he was viewed through. It wasn't virtuous or good or, progressive or, somebody who tells the truth. It was, geez, is he winning? And if it looked like he was winning, well, then my brand stayed pretty okay for him. And that's how I saw him. So, that's why he could stand up and say, I don't pay my taxes. That makes me smart. That's why he could tweet all the things he was tweeting, because as long as it looked like he was winning, well, then therefore I was okay with the brand that I had for him as one of his supporters. So that's just why branding matters and what it is. When you're putting together your online profiles, when you're deciding, what would you like your brand to be, the most important step is actually just making that conscious decision. What do I want the words that are associated with me to be? Just deciding what you'd like your brand to be is the most powerful step you can take. Is it professional? Is it credible? Is it insightful? whatever it might be. What would you like your brand to be for the people out there who are engaging with you, that you care about? What are the 2 or 3 terms you'd like associated with yourself? And once you decide what you would like your brand to be, you can then use that as a decision-making tool, day to day, week to week, month to month. Okay. So I had someone who came to me for media training a couple of years ago, and they would just become relatively well known. They've been around for ages, but the way you kind of become an overnight success, overnight, even though it takes years and years to do it, they become known. And so they were being inundated with requests to do media. People from college 15 years ago were suddenly their best friends because they're a producer on a show that they wanted on. They were being asked to do, dozens and dozens and dozens of things, and they were overwhelmed. And so we just sat back and said, right, hang on, how do you want to be seen? And all they cared about was to be seen as insightful in Irish society. That was their thing. That's what they wanted to be known as. That's what they valued about themselves. And I said, right, every time you get a request, the question you're asking yourself is this giving me an opportunity to be insightful on an area of Irish society that I have insights on? And if it is, you do it. And if it isn't, you don't do it. Doesn't matter what they're paying you. Doesn't matter if you feel guilty. It doesn't matter, if you know them for a long time and you'd feel bad saying no. That's no longer part of your decision. It's very much, will it give you an opportunity to build the brand that you want? And so it becomes quite binary. That's how you make a decision. Now, when you're deciding, will I tweet this or not? Will I engage with this or not? How will I word this? What's interesting about this? What do I want to pull out? How much work am I willing to put in? All of those questions, they should be seen through the lens and the prism of, hang on, how do I want to be seen? And will this help me to be seen that way? And if it will, you do it, even if you're nervous about putting your research out there into the world, which is an absolutely fair thing to be nervous about, but that's no longer a concern. The concern is, will it help me with my brand? And if it wouldn't help you with your brand, but you really want to say it because you want to maybe reply to somebody, or, you had the idea and you think it's great, but, you're a bit worried about it. Well, then if it won't help you with your brand objective, well, then you don't do it. So deciding how you want to be seen is really, really important. Now, we'll never establish exactly the brand with the words that we want all of the time, but the decision will help focus you and will therefore make it more likely for that to happen. The second, I suppose, step, defining your brand, using it as a decision-making tool. The second quick step is you then need to work hard, because just deciding how you want to be perceived means absolutely nothing if you don't have the content to back that up. So somebody who wants to be seen as insightful in Irish society, that's absolutely brilliant. But if you've no insights in Irish society, well, we're not going to make that happen for you. So similarly, if you want to be seen as incisive in your research, if you want to be seen as hardworking, if you want to be seen as professional, well, you then need to put the work into pulling the content out and presenting it in the right way. So working hard, it's an easy point, but it's an important point to make when we're talking about things that are about perception, because it's not about changing, it's not about false perception. It's about making sure that you're perceived accurately. Because we can be perceived inaccurately if we don't focus on it from time to time, and that takes hard work. And then the third thing that's important when you're thinking through your brand is who out there do you care about? Who is your audience? Who are you trying to reach? And you need to have a very, very clear idea of who it is that you're trying to reach. You might have a few of them, but you should be very clear on who your audience is, because when you're broadcasting on social media, you're broadcasting to everybody, which means you then end up maybe going for a very general audience or just talking to yourself, which means then that you're not going to be as insightful, engaging and understandable to the audience that matters to you. It's another thing that's very relevant for media training that we do. So I would have been a media trainer for the Together for Yes referendum campaign a number of years ago. And one of the things we did in that campaign consistently was, if you were going out on media, you were never talking to a general audience. You were never talking to even a profile or a subsection of an audience. You were talking to a person. You were talking to your cousin, you were talking to your uncle, you were talking to a friend, somebody who was representative, yes, of a wider audience, but you knew their name, you knew their age, and you knew the person, and everything was tailored to that individual. Because if you can reach an individual, you can reach a group. So when you're thinking about your brand and your posts, you need to, in your head, have, who are the people who are reading this? Who are the 3 or 4 panel of judges, let's say, but kind of positive judges who I care about, who I would say I'd want them to value this. I'd want them to think this was good. I'd want them to think this is insightful. And that panel should be in your head all the time, but they should be real people. They should be engaging. It will also help you to stay understandable, in terms of plain English, in terms of the not using acronyms. It will help you stay in line there because you can look at the judges and say, actually, they wouldn't have a clue what that is. And if they wouldn't have a clue, well, then the audience I'm trying to reach behind them wouldn't have a clue either. So define your brand, work hard to make sure that it's authentic, and that you put the work in to make sure you can live up to that brand, and make sure that brand is tailored to individuals that are representative of the subsections of the whole country that you're actually trying to reach, and keep those people in mind. So they're kind of core pillars of online branding that are not relatively important, are incredibly important. Everything I say is incredibly important. The other two more general tips I would have, and then I'll see if anybody does have questions for me, is number one, if you want to do this stuff and do it well, you're better off having a content calendar, having a box of content put together so that you can do everything in big chunks of work, rather than the constant worry of, God, I should be posting on social media more. I'll throw something up today, and then the anxiety builds again, and you wait another 2 weeks and you throw something up then again. You're actually better off saying, hang on, over the next 3 months, what am I going to post? What can I put together that's going to be relevant to the brand I'm trying to establish? What can I pull out of, the research I'm hoping to do, the research I'm doing, the findings I have, the aspirations I have? What can I pull out that's interesting? And turn that then into a content calendar or a big box of content. That just means that once every 3 days, you just pick from the box, say, there we go, there's something ready, here we go. It's easier to spend 4 hours saying, right, I'll get all that done, than spending an hour every week and then 3 hours worrying about spending that hour as a task you must do, because that then becomes a chore and it all falls apart quite quickly. Well, if you do big chunks of work and get your interesting content shot and ready and all well to go, you'll be much more likely to actually build that successful brand as you put it out there. And then the posts themselves, the videos themselves, it should be consistently one interesting point that's interesting at read to the audience that you have picked. All right. So rather than, here is my research and all of the findings, and now that's done and I can never use that again, it's, here is a finding and here's why you should care about it. If you want to know more, you can read on. So almost think about it like a headline in the 6-1 News, where if you think of the headline in the 3 or 4 sentences, every headline in the 6 News will give you the core information and why you as an audience should care about it. Every single headline will go down that breakdown. Here's what happened today, and here's why it's relevant. Think about your posts in a similar way. Here is the interesting thing. Here is why my panel of judges should care about it. And that means you can show me the same research 10, 15, 20 times, because there's different interesting angles to it, different interesting points. So remember to think of it at one point at a time, and it's about why it's interesting, why it's relevant, why I should care about it as one of your judges.
Thank you very much. So I'm just going to bring up my slides here. So thank you very much for the opportunity to talk with you today. Many of you will know me in my role with the All Ireland Institute of Hospice and Palliative Care, but I also work for the European Association for Palliative Care as a research and project officer. And what I want to talk to you about today is a little bit about research videos and how to create impact with them. So I'm just I'm showing my slides okay, Marie? Yeah, okay. So perfect. Really, when we're thinking about research videos and how to create impact, I think the first thing to think about is, well, why bother creating a research abstract or a video abstract for your research? And I think really in a nutshell, the right mix of opportunity, motivation, ability, videos can be really powerful, really engaging, and a way of drawing attention to your research, which increases the reach beyond your traditional dissemination methods. Great videos, though, don't happen by accident, and really thorough and thoughtful planning is crucial to get it right. So I want to sort of take you through a few steps for successfully creating any kind of video. I think the important thing is about identifying your goal. So what is your goal for your research video? Is it about launching your research maybe? Is it about engaging new participants? Just as Marie said, you could be thinking of your video right from the inception of your research through to dissemination. Is it about sharing findings? Is it about influencing policy and practice? Who then are your audience? Are they the clinicians? Are they patients? Are they researchers? Are they the public? Think about that very carefully, because if you think about, what you want to avoid is having multiple goals for your research, multiple audiences, because if that's the case, if you're thinking about having multiple audiences, multiple goals, maybe the thing to think about is multiple videos. The more goals, the more ideas that you try and pack into your video, the more likely you're going to complicate your script and you're going to completely confuse your audience. Think about the tone of your video. How do you want the person to feel who is listening to your video? Is it about just information giving? Is it about creating a conversation? Are you trying to elicit some kind of emotion from them? Is it about an urgent call to action? Is it something that you want them to do to engage with you? I think the tone, the most important thing about your tone is that it's not boring. Think about the platform and the duration of your video. So where will your video be viewed? If your goal is to promote your research webpage, then a 30-second promotional video on social media is probably more than sufficient. If, though, you want to share findings which are going to hopefully influence policy and practice, you might need a bit more time to get your job done, and you might need a more permanent platform to share that video on. The next thing then is choosing the style of your video. So are we talking about a piece to camera? Is it about a screencast? So looking at your laptop screen and recording what's going on in it? Is it about a video animation or a whiteboard? And I think when you're thinking about what type of style, think about back to those first 4 steps, as all of those factors should influence the video style that you go with. The next thing to do is to really outline your idea, and that's about summarizing your video idea from a very high level perspective. Really it's about the elevator pitch for your video's concept. So if someone's asking you what's the video about, it's your top line for what the aim of it is to do. And from that you can go on to develop your script, which is your blueprint and your foundation for your video. So that's a chronological rundown. So second by second, ideally, of your video, setting the scenes, the action, the audio content. And it's quite important to be thinking about the total time that you want to dedicate to your research for your video. So rather than creating a script and then having to try and condense it down to fit a video time frame, it's much easier if you start with, well, how much time do I want this? Do I want it to be 90 seconds? Do I want it to be 60 seconds? That will really help you when it comes to scripting and ultimately then storyboarding, which is the next part of creating the visuals that will go with your script. Following on from that, obviously the next step is to produce and pilot your video. So think about the location of the production of your visuals and your acoustics. And again, Marie is very helpfully going to give you some guides specifically on that, on getting your location right, thinking about your background, thinking about your lighting, your acoustics. Piloting is really, really important. Again, depending on the type of video that you're going to go for, depends on how important this step is, but it is really helpful to get feedback from your peers. So, about the messaging, about the pace, about the overall look and feel. Have I spoken too fast? Have I lost people? Have I added jargon when I didn't mean to? And how clear and how authentic is my message that's coming back? Will people actually understand what my video was about? So I'm going to share 2 short videos demonstrating the use of animated videos that have been produced from a European perspective in 2 projects I've been involved with. One was produced in-house, very low budget, and the other was professionally created.
Following a cancer diagnosis, patients face a series of challenges. They have to make difficult decisions about treatments, deal with an additional daily burden, and cope with fear and anxiety associated with a life-threatening disease. Cancer is a challenging experience for both adults and children, as well as their families and friends. Healthcare providers also encounter many challenges while caring for patients with cancer. Communication with patients is quite demanding, and it often requires a sensitive approach, starting with the announcement of the cancer diagnosis and all the way through to treatment courses and possible relapses. During the course of cancer, the patients will experience a variety of physical and psycho-emotional symptoms. These will have to be addressed by a team of healthcare professionals specially trained in palliative care. The ultimate goal of palliative care is to improve the quality of life of patients that go through life-threatening diseases like cancer. For palliative care to be most effective, patients need to participate actively and communicate their personal needs as they arise. In recent years, digital health technologies have provided significant aid in various aspects of healthcare, including palliative care. These technologies are often used to build modern and powerful digital health platforms addressed to patients, their carers, and healthcare professionals, connecting them virtually. This is where MyPal comes into play. MyPal is an ongoing initiative aiming to develop and test digital health solutions for palliative care in cancer patients. In a nutshell, MyPal is a digital health platform that makes uses of modern digital technologies and methods to support cancer patients, their carers, and physicians in various ways. MyPal aims to facilitate patients to record and communicate their symptoms, but also to improve their knowledge about their disease. Moreover, the MyPal platform promotes the active participation of patients in the management of their disease, including care decisions, and motivates patients to adhere to treatment via personalized messages. With MyPal, adult patients can report their physical and emotional symptoms on their mobile using the MyPal Adult app. Children with cancer do so while playing the MyPal Child game on the family's tablet. There is also a smartphone application for the carers of the children, while the treating physicians will be able to monitor patients via the MyPal web portal. The MyPal solution will be tested by cancer patients, their carers, and their physicians in 7 clinics in 5 European countries. If the test is successful, the MyPal solution will be promoted as part of routine palliative care of cancer patients throughout Europe, with the ambition to improve their quality of life and outcome. Join us now at the MyPal website and social media.
So it probably won't take geniuses to work out which was which, but I think they both have their place, and they both are able to deliver a message. So I'm not suggesting either of them is perfect, but it's just interesting to look at how animated videos can be used. And there are a whole lot of tools that you can use to develop animated videos. And I've just put up on the slide here a few examples of some of the free versions that you can use. There's a caveat to that in that they are branded. So if you want to use them without the branding from the company, then there is a cost. So I just wanted to briefly touch on looking at the development of research videos for poster abstracts. And I suppose I have a vested interest in this, being a part of the European Association for Palliative Care. I'm really hopeful that some of you, or hopefully a lot of you, will have put in abstracts for this year's AIIHPC Congress. And for those of you who are successful in submitting for a poster abstract this year, as well as submitting your poster, you will also have the opportunity to produce a video to go along with the poster. So this is up to 2 minutes that you can produce a video to direct to the platform. So it's a matter of recording a head shot video like this directly onto the platform. And I suppose the question is, well, why should I create a video abstract for my research poster? I suppose the thing about this is that the AIIHPC have provided you both the opportunity and the ability to do it, in that it is integral onto the platform. So then the question is left, is the motivation there? So if your motivation for submitting an abstract to the conference is purely to get a citation, then obviously you're not going to be interested. But if you have motivations beyond that at all, be that wanting to network with people, wanting to get people to recognize your name and your face from a European level, to start to recognize you as a researcher with an authentic voice in your topic area, then absolutely the question would be, why on earth would you not submit your research video? The tips for success for creating that abstract video, exactly the same as the ones before, albeit that some of the steps are predetermined for you. So the audience will already be determined, the platform, the video style. What you do, though, have control over is identifying your goals. So is your goal for that video to increase your poster views? Is it to get more people reading your paper, reading your research, or about making contacts, making connections with people, encouraging them to get in contact with you, being accessible? Setting the tone then is about you thinking, are you wanting to set that in a more chatty fashion again to try and encourage people to make contact with you, or is it about being more professional? It is still important to write your script, but as you will have noticed that when you're doing this kind of piece to video, if you're reading from a script, you break contact, then you stop looking at the person, and that in itself reduces the impact of what you're saying. So rather than creating a full script, it is good to write the script down so that you're clear about the length of time that you have when you're speaking, but then just create some bullet points for yourself, and it's those that you will then use when you're talking to your audience. Producing and piloting, I've kind of put a question mark beside that because it will be done directly onto the platform. So it's very hard to get people to view it before it goes live. Obviously, people will be viewing it during the conference and be providing you hopefully with some feedback. Just a few final thoughts and tips for success for creating your video. Definitely following that steps to success plan. Keeping subject-specific technical terms to a minimum has already been mentioned a few times, avoiding any acronyms, trying not to read off your script if you're talking to video, and try to end with some sort of call or calls to action. So think about what is it that you want your audience to do once they have interacted with your video. What's the what's next in this for them?
I'm Clodagh Donovan. I work in the Institute and I am the PCRN project manager. So why am I doing a video, presentation on video editing. Well, before I worked in health research, I was nearly 20 years in film and television post-production. So this is kind of my area. So what do I want to tell you? Well, what's important about creating a video? Obviously, Marie and Kathy have already talked about most of it. I want you to just bear in mind, you're not a video editor, and you don't have to be. It can be quite simple. I mean, you can see from Marie's video, she did a fantastic job editing it, and she's not a video editor. So focus on the fact you're a researcher, focus on your message that you're trying to communicate clearly. And the most important thing is keep it simple, because if it's complicated, it'll take away from your message. So what is not important? Well, the software you're using is not even the tiniest bit important. So let's talk about software. Do you need a professional setup? Of course you don't. As Marie mentioned, Windows 10 have a pre-installed video editor, and it's called Video Editor, which is very helpful. Older versions of Windows have a thing called Movie Maker. And if you want to download a specific piece of software, you can use Movavi, which I recommend. It's really good. It's a bit more comprehensive, and Shotcut as well. If you're a Mac user, the pre-installed iMovie app is excellent. And also you can use Camtasia, which is also available on Windows. I'm not a huge fan of it. I know Kathy loves it. It's each to their own. But for today, we're going to focus on Video Editor. And I'm going to give you 8 steps to edit your research video. So the first one is to prep your media. What is media? Well, it's your video, which you're going to shoot. It's your graphics, so like your title frame and your bits of charts or data or whatever you want to show, and any audio you want to use, like, for instance, the additional voice that Marie recorded over her graphics, or music if you want it. So your second step is to set up your project locally. Why do I say locally? Well, if you're editing sound or video across a cloud, so if your video and your audio is on a cloud service like SharePoint or OneDrive, it causes trouble, and video editing is hard enough as it is. You just want to keep it simple. So do it locally, keep it on your local machine. You can always upload it later when you want to, when you're finished. So how do you open Video Editor? Well, you press your Windows key on your keyboard, or you can click the bottom left-hand side, enter Video Editor into the search box, press enter, and it will open. You're going to create a new video project. You're going to name your project, and just at the top right-hand side, there's 3 little dots. Just double check that it's in 16:9 landscape. It should be in that default, but it's a thing just to check for, because you want it to be full screen. So it will open like this, except without the mad pink writing. So I just wanted to give you kind of the lay of the land. The top left is your project library. That's where most of your media will sit. When I say most, your audio doesn't go in there, but your video and your graphics will go in there. The top left. Top right is your preview area where you're going to view your video. Underneath are your transport controls, your play button, which changes to a pause button when it's playing. And the 2 little arrows on either side will nudge your video a frame to the left, a frame forward or a frame back. What's a frame? Well, there are 25 frames in a second. So it's just a still image. That's all it is. And then underneath that, you've got your storyboard, what they call your storyboard, which is basically the building blocks of your video. There's also some, I don't know if you can see, there's some menu items just below the transport controls and menu items just above the preview area. So the third step is to import your media. Now what I'm going to do, I'm going to push on just to show the 8 tips, but I'm going to swap to the actual application. Can everyone see that? Hopefully, yeah. And so what I'm going to do is I'm going to import the media. So I'm going to browse to I have 3 pieces of video that I'm going to drag in. So you can click and drag from your folder into the project library. And you can see they go in there. And I also want to add some graphics. So I'm going to go to my graphics folder and I'm going to take these 4. Now I have created, I'm using Professor Suzanne Guerin's video on MTrek, but I've just created some fake graphics. So don't mind, it's not of any relevance at all. The 4th step is to drag your media onto your storyboard. I say in the correct order. To be honest, it doesn't really matter because you can move things easily enough. So I'm going to show you that. So I can select everything. I can untick the ones I don't want, for instance. And I can just click and drag it downward onto the storyboard. Now, what I'm going to do is I'm going to pull, so just to show you, you can move these blocks really easily. I'm just going to pull the video to the very front here. And what I'm going to do is I'm going to show you how to trim your video. Now, what I'm going to do, so I've got it selected and you can see it's come up in the preview window there. I can just play it. What I'm going to do is I'm going to press the trim button. Do you see that just above where the storyboard, the top of the storyboard bit? And what you can do is you can pull, so this little round dot displays where your playhead is essentially. It's where you've paused your video. These handles, so the handles will snap to where your playhead is, but you can click and drag those to any point. And I kind of want it around. I'm just going to play it really quickly.
Research on practices on.
No, that's not what I want. I'm going to do it around here. So I'm just going to use these frame nudging buttons to go back to the very first frame of Suzanne. Her title has changed since then. She's professor now. Sorry, very slow. Okay, I'm just going to split it there. So I'm going to press done over here. I've trimmed it there, so that's fine. And then what I'm going to do is I'm going to show you how to split your video. So this is one video at the moment, so I'm going to just randomly split it. I'm not even going to listen to the audio, so don't mind. So I'm splitting it into two pieces of audio because I want to insert something in the middle. So our next step is to insert graphics. So I'm going to do that. So I've selected a point here. What you will do is you'll listen and make sure you're, at the end of a sentence or whatever. But I'm just going to do this randomly because we don't have time to be particular. So I've now got two videos there at the bottom left, you can see. So what I'm going to do is I'm going to move these graphics that I've created, which are just random. They mean nothing. And you can see at the bottom left of each thumbnail there, you can see the duration that the video clip or the graphic is on for. So this is 1 minute and 3 seconds. This is 3 seconds and 3 seconds. Say I want these videos to be there for longer. I can click them both, right click, choose duration, and change that duration to whatever I want. So that people have time to see the graphic. So now I've got a piece of video, I've got a graphic, I've got a piece of video. I can add in voiceover over those graphics or music. For the moment, I'm just going to add music. So what I'm going to do is you can click background music and it puts it throughout the whole video. You may not want that. So I'm going to choose custom audio. I'm going to add the audio file. And I've picked a free piece of audio here. And I'm adding it. Now you can see what this has done. It's at the bottom of this timeline. It's shown you the area that it's putting it in, but I want to start from the beginning. So it's doing it from the playhead, so that's okay. Actually, it is from the beginning of that piece, so that's fine. And I'm going to hit done. And then I'm going to go to the next graphic and choose custom audio. And it's there, so that's fine. So that audio is there now, and I'm going to just quickly play, just so you can see now the Suzanne. I've basically interrupted Suzanne, so just ignore that because I haven't been listening to the audio. But I'm just going to play it really quickly.
Good communication, you have to use.
So I basically interrupted her, but that's okay. So if you want to change the volume of that audio, you can do it by clicking here and adjusting the volume. You can also create a fade out, which is probably a good idea. So that's the basic idea there. Let's go back to my cheat sheet to see what I'm supposed to be doing next. So we have trimmed and edited the video. We've added graphics and music. If you add voiceover, it's going to be exactly the same way as the music. I'm going to show you how to do a title. Now, they do have a thing here that says, so I just need to move my Zoom window a bit, that says, add a title card. I would recommend you don't do that. You can either create a title card, say in PowerPoint or an online graphic service like Canva, canva.com. It's very good. That's what I created these graphics in. But I have a piece of stock video of a fake scientist pretending to do sciencey things. So I'm going to use that. And what I'm going to do is create text over it. Now, by default, what it does is it chooses simple. I would recommend you, I'm going to just type some text in here so you can see. So by default, it goes down at the bottom, and you can use it for somebody's title, or a website you want to link to or whatever. You can change where it goes at the bottom here. But for this one, I'm going to put it in the middle, and I'm going to change it to this because it blurs the background and I quite like it. I also want that effect to last for the whole clip. So I'm going to trim out my handle, press done. And then I'm going to play it from the beginning so you can see how that works. I'm going to just expand this view so you can see it bigger, okay? So you might put a little music at the front of that as well, because it's your little title sequence, and then fade it down. You also might want to trim the video a little bit smaller. So that is pretty good. We have prepped our media, set up our project, imported the media, dragged it onto the storyboard, moved them around, trimmed and edited the video, added graphics, added music, added titles. So now we're ready to export. We're happy with that. So the top right, there's finish video. So I'm actually going to delete my cheat sheet because I don't want that in the video. So you press finish video, and there's options in terms of video quality. I would always go for the highest quality possible, unless you're doing something like online streaming or it's for Facebook or something. I would choose the medium version. The low version you can use for websites that have very narrow bandwidth or something like that. But high or medium is what I would choose. And if you're doing it for a conference, they should tell you what resolution they want. So what you normally do is you press export, you choose where you want it to go and what you want. Well, you've already named it. And it will export, and it'll automatically play that video when you've finished. So I'm going to go quickly back because I have a few more tips for you, just really quickly, because I know we're into our break time now. 5 really quick tips. Play with this. Don't wait until the day before you have a deadline for a conference to get a video in. Take your mobile to your local park with your kids, your dog, or whoever it is. Shoot some video, go home this weekend and just play with it. Just put together a video for your kids, Nana, and send it off. Because honestly, you will learn more by doing that than waiting until you have a research video to create. So play with it, you will learn, and then it'll be easy. Always ask somebody to have a look at your video before you're finished, because they will spot things that you won't. Things with video editing always go wrong. So if you have a problem, just start afresh. Sometimes just shutting down the video editor and reopening will be fine. Sometimes you need to start from fresh. Don't panic, it'll take you much faster the second time. I said save a lower resolution for web, and always keep it as simple as you can. And that's it. Thank you very much.
So, folks, I'm just going to introduce myself. I'm Sean Driver. I'm from Kildare, but I work in Dublin. I've worked 2 years as an editor and 8 years as a trainer. I used to work as an ESL teacher, so English as a second language. And basically my job is to help organizations improve their communications, editing and doing training. And I love when people feel empowered to use plain language. So yeah, you all write every day. So think of yourself as professional writers, and think of plain language as a tool you can use when you want to communicate with your colleagues and when you want to communicate with the wider public in a kind of accessible fashion. And then my hobby is I like to cycle and invite tips for new routes. So if anyone has any great routes, send them to me. Perfect. Okay, so this is what we're going to be looking at in the presentation, folks, and talk about NALA a little bit, the National Adult Literacy Agency in plain English, looking at common web writing habits, doing some group work, and then having a discussion. Great. So my aims are, at the end of the workshop, you should be able to do these 4 things. Think of your readers, learn about the level of literacy difficulties in Ireland, describe what plain English is, its main benefits, and then look at web text and think about why it's difficult, and then change it, and then use the plain English techniques to have a more friendly style to make your web writing clearer. So that's the 4 things I want to do. Great. So folks, this is the #1 resource I think will be useful to you. So whenever you write something, whether it's an email, a report, a blog, this is our checklist. Okay, so it covers 20 points in terms of language, punctuation and grammar, structure, and page design. And they all kind of interconnect with each other. Okay, so I did a great training session with some planners down in Waterford, and they kept using this word permeable design. And I was like, that's jargon. And then they explained it to me, it's like, actually things interconnect, So like point 1 actually is relevant to point 13. I was thinking, makes perfect sense. Thank you. So yeah, these are kind of permeable, where they all kind of interact with each other. Okay. So what I want you to do, folks, is I want you just to have a minute now and just read them and put them into your head. So when we're doing the group work and we're looking at text in detail, I just want these to be in your head. So take a minute there. Okay, so there are the points on language, punctuation, and grammar. Okay. And there's the points on structure and page design. Just have a quick read of them one time. Great, folks. So if there's one resource that you can depend upon when you're writing your blogs, this is a good one. Okay, so we're going to talk more about this. Just want to introduce it at the start. Okay, so the number one point, and it goes back to what Lorcan said at the start. So imagine that panel of readers. So imagine your reader. Remember that good writing makes the reader's job easy. Reading should be pleasurable. Should flow very well. Bad writing makes it hard for your reader. So the longer you spend writing something, the quicker it should be read by the person, especially on the web. Okay, so good writers have cultivated an abiding empathy for the readers. So, you work in healthcare, so that empathy is very important. You already have it, but just remember that when you're writing something for someone, you gotta have abiding empathy for them to make sure they understand. Okay, so I want to front load these tips. Okay, at the start. So when you're writing for the web, imagine your readers, and a useful way to do this is with your blog. Just think about who your audience is or are, So say, I am a health care professional, I want to learn more about palliative care so I can, improve my practice. Okay, that's a very general one. I am a member of the public. I want to learn about palliative care so I can help my loved one, So when you're writing something, just do that as an exercise to start. I am someone, I want to do this so I can do this. That's a very common thing in writing for the web. So imagine your readers. Use the inverted pyramid of writing. Sounds fancy, but it's the same point that Lorcan made, where he said, think of the 6-1 headlines. So you want to find the hook, you want to find the main message, put it in your title, put it in the opening paragraph. People are reading online, they scan, they skim. So you need to find that hook and it needs to be at the very top. So the inverted pyramid of writing just means put your most important message at the top, less important in the middle, and the details at the bottom. Okay, that's the inverted pyramid of writing. Related to these, that is that use white space and the headings to break up text. Writing for the web is a lot different from writing for print. You have a lot more space. People read in chunks. Often when you're reading blogs, you'll see, a 1-line, 2-line paragraph, a 3-line paragraph. That's okay. That's how people read online. Use everyday words, the words of your readers, and then explain jargon. So we'll talk more about this, but I think that, when you're writing a blog, you want to bring people on a journey. So you might start with, what does this word mean? And then explain it and then refer to it throughout the blog because you want to educate people, you want them to learn something. So that's what you want to do. So use everyday words and then explain the jargon. And then very personal, use you and we, make it personal. So that's something that's very difficult, I think, for academics because, it's, what's the correct word for bet into you? It's kind of, you're educated to believe that you can't be personal as an academic. It has to be, use the passive voice. But when you're writing for the web, when you're trying to reach people to share your research, you want to make it personal. So don't be afraid to do that. Okay. So again, just front loading my tips. Imagine your readers, inverted pyramids, use white space and headings, use everyday words, explain jargon, and use you and we, make it personal. So if I was to make it personal, folks, I would think about like my own life. And like last year when I was in a hospital environment, a doctor said to me, oh, due to the GBS, we're going to, the MDT have decided to use IVIG on your mother, So due to the GBS, the MDT have decided to use IVIG. I was like, oh, okay, perfect, So, what does that mean to anyone? Didn't mean much to me then, means a lot to me now. So you have to kind of, when you're using technical terms, you have to kind of scaffold them. GBS is Guillain-Barré syndrome, IVIG is a type of treatment, and MD, is it MDT, the multidisciplinary team. So I'm up on that now, but at the time, very stressful environment, I was lost, okay? So all about empathizing with your readers. Okay, folks, that's the main message. So, NALA, plain English, who are we and what do we do? So this is the bit you're told never to do, but I have to explain who NALA are, okay? So NALA are the National Adult Literacy Agency. We run an awareness campaign to help people with literacy who have unmet literacy needs, so people who struggle to read and write and use technology. That's what we do. And we create resources for them to help them. Every citizen has a right to literacy and numeracy, okay? Think about NALA's work as kind of coming from two ways. We want to make, improve people's skills, but we want to make society more accessible. So we use plain English to make sure everyone can participate in society. So just the latest developments in adult literacy, Minister for Further Education Simon Harris has launched a 10-year strategy. You may see this in the news. You may be interested in it. NALA have booklets on our policy on the next 10 years for literacy strategy. Okay, literacy strategy. Okay, and our AGM was was on Saturday, and Simon Harris spoke very eloquently about delivering that. Okay, now they're in plain English because we want to help more people participate in society. So we have an editing service, we have a training service. So you may have seen that the program for government included an expectation to have a plain language requirement in all public service communication, so people can understand information the first time they read or hear it. Using plain language saves time and money and reduces mistakes and complaints. Look, consult with NALA. So the point of these is that plain English is a way to write. But it's also international movements to make society more accessible for everyone. Okay. You may have seen some of our work with the Department of Social Protection. So you see the plain English mark on some of their guides. So look out for it. This means that it's been through our editing service, and we believe it's reached a certain standards. When we talk about standards in plain English, the ISO, I can never get their acronym right. The International Office for Standardization. It's French, I think. They're working on a plain language standard at the moment, so it's still ongoing. So at the moment, we're talking about guidelines with a checklist. So hopefully we'll move towards a standard. And we work in the health area a lot. So you may have come across these in your work. So last year I worked with St. Luke's on a guide for patients for palliative radiotherapy, a guide to compassionate induction of labor, and then information for families of organ donation. So, people in very, very stressful moments of their lives, and you want the information to be, as accessible and as easy to read and understand as possible. Okay, so folks, this is my first interactive question. In the chat box, folks, just, for 30 seconds, have a think, and then put down, 3 words or a sentence to describe what is plain English. What's your understanding of plain English? Great stuff, folks. Good answers coming in. Understood by all, non-jargon, easy to understand, simple, concise, clear, easy to interpret, simple as possible without being simpler. It's a good one. Easy everyday language, spoken English, understandable, like a chat, yeah, easy to understand. Yeah, good work, folks. Having a quick scan through anything there. Understandable, memorable. I like that, Aiden, memorable. Yeah. The messages are memorable. They stick with us, don't they? Appropriate reading level. Words put together in a way everyone can understand. Yeah. Great. So it's understanding of plain language or plain English, folks. So this is the way NALA tried to define it. So it's a way to write and present information so a reader can understand and act on it after a single reading. So that bill that comes through the door, that letter that comes through the door, that web text, you should be able to understand and act on it, because the information we're giving people has a point. You should be able to use it after a single reading. That's the ideal, folks. Oftentimes that's not possible, but that's what we want to aim for. It means writing accurately and clearly for the intended reader. So you can look at plain language as a way to try to write for everyone, or you can look at plain language techniques as a way to write for an intended reader. That's healthcare professional interested in palliative care, or a general reader. You'll have maybe tailor the message depending on the readers. Okay, avoid jargon so that people understand it, and use clear layout and design so the information is easy to read. Okay, so not just language, but more of a structure and design, which will become clear. So myths about plain English. So my friends like teasing me. They say, Sean, how's dumbing down the world going? So plain English is not dumbing down the world, folks. It's helping more people, access information, helping us who have so much to do and so much to read, get the information we need to do our jobs quicker. Okay, so it's not dumbing down your message. It's realizing people are busy. You want more people to participate. It's accessing up. It's not patronizing your reader. It's not talking down to them. It's just making it as simple as possible. Think of plain language as clarity. Okay, it's not changing the meaning of what you're saying. You have to work really, really hard to make sure that when you have your research findings, that you're not changing the meaning of it when you put it in your blog. It takes a lot of craft, a lot of work, a lot of drafting to do that. That's not only use short words and sentences. Okay, there has to be a flow. There has to be a structure. Sometimes you might have to use a 30-word, 35-word sentence if that's what it takes. So trust yourselves. Okay, so folks, just to talk about all the different readers who are out there, and when you're writing your blogs, you should have an audience in mind. So maybe you'll take a piece from your blog and you might put it on social media. So you might want to be aware of people out there who might be emerging readers. That's what we call people who go back to education, who want to develop their literacy and numeracy and technology skills, kind of emerging readers. So this is from the 2012 OECD study where they do Europe-wide surveys of adult skills. Level 3 is the junior cert level, that's functionally literate. Level 5 is your leaving cert. Level 8, your ordinary degree or honors degree. Level 9, master's. Level 10, PhD, the kind of skills levels. Okay, so anyone want to have a guess of one in how many adults, one in number adults are level 1 literacy? So this is may struggle to read information on medicine packets. Anyone want to type in a number in the chat box? $20, thanks Alan. 1 in 10, 1 in 4, 1 in 50, 1 in 10. Yeah. So 1 in 12. So folks, according to 2012 adult skills survey, it's 1 in 6 adults. That's 18% of 500,000 people. Okay. Then 1 in 4 adults are level 1 in numeracy, 25%. So 750. And then 2 in 5 adults level 1 in technology. So and the big drive towards putting all services online to make sure people aren't left behind. Okay, so that's just a literacy issue in Ireland. We're about 3/4 in Europe towards the end. So there's 24 countries did the survey. I think we're about 17th or 18th. So speak briefly about health literacy, which is the kind of space you find folks are working in. So research has shown there are a few errors and better treatment outcomes when there's good communication between patients and their healthcare providers, when patients are fully informed and educated about treatments and medication. Okay, so the more you educate people about healthcare, the better their lives are. Okay, so often people, with unmet literacy needs, may not have access to great healthcare because they aren't educated about it. They don't want to educate themselves about it. So, but when you improve literacy, you improve lives in all sorts of ways. Okay, so who's reading what you write when you write a blog? Those are highly literate, people with degrees, people who have functional literacy skills, those with poor literacy skills. So, you have to strike a balance between all of them. We're going to look at that. But what readers have in common is that they're impatient. They are looking for information. They want to get it. And if your writing is getting in the way of that, they're going to stop reading. People scan for information when they can. How they scan depends on the motivation. They could be in a vulnerable life situation or stressful situation. Be looking for information about healthcare for their family, for themselves, and they have a purpose. So should you. Get to the point. So are they interested in all the background of your research, or are they interested more in how it affects them? So just some brief reference guides that I'm going to point to. So this is the one on the left is Simply Put. Rui's going to send around links, and that's a really, really helpful one. It covers all the plain English guidelines in depth and illustrates them very well. If you're doing writing, digital, or spoken and signed in any way, the NDA, the National Disability Authority, have a great toolkit really fancy name, Customer Communication Toolkit for Public Service, Universal Design Approach. So universal design, just making everything accessible to everyone. Think of your buses that have ramps and are painted yellow so people can see the safety bars. So that's universal design, but it applies to media as well. So when you're talking about subtitles earlier, folks, subtitles help more people engage with content because they can read it if they can't hear the audio. So subtitles and things part of that. And then the HSE have guidelines for communicating clearly, which we should all know by heart. I'm sure you do. That's a good resource, and I'll send you the link for that. Great. Ones that I really like on the web, you may have come across, the HSC content team have a content style guide. I'm just going to ask anyone, has anyone ever come across this or used it in their professional lives? Marie is nodding furiously, that's good. Anybody else? Yeah. So I really like this. It has lots of good things about it. It has just content principles. We meet a user need, we use data and evidence, we write in plain English, right, so it's easy to understand us. We follow the style manual. So style manual, that sounds useful. So, if you have a query when you're writing your blog, just check that. It includes tips about capitalization. Don't use block capitals for large amount of text. It's quite hard to read. Okay, it slows people down. If you have questions about numbers, measurements, dates and time, there could be something there in the HSE content guide. I think it's really useful as a resource. So I'll send you the link to that. They have an A to Z of health writing. So for example, don't say alcohol, say alcohol misuse, not alcohol abuse. So they can notes about inclusive language, correct terms to use, plain language. Don't say anus, say bottom, apply, referring to a medicine, use, put on, or rub in. So tips like that might be helpful for you. Okay. Writing for the web, there are some guidelines. I really liked Marie's guideline about how many words to use in a video, because that's the really kind of nuts and bolts that you want. So NALA have a style guides that we did with the public service, and it's the same as the NDA. So they suggest 600 words on a page is the maximum you should aim for. Of course, you can break that rule if you need to, but 600 words on a page is the kind of word count people expect on a web page. Okay. Similar in the NDA guides, they have look down here, folks. They have a nice bar, which is headings 8 words, sentences 15, 20 words, opening paragraph 30 words, other paragraph 60 words, and the web page 600 words. So that's kind of from the NDA, the National Disability Authority. So that might be helpful for you. Okay. Other resources that if you're interested in plain language after this presentation is you can look for the Plain Language Association International's website. They have a conference coming up about access for justice for all. Colleagues in other NGOs, I'm not going to put that there, but your colleagues in healthcare, they can, and the great thing about this, the All Ireland, I always get it wrong, the All Ireland Hospice and Palliative Care Institute, is that they're, coordinating great research and, great skills sharing between each other. So yeah, your colleagues. If you want to help me out, you can join something called the NALA Plain English Network on LinkedIn. So just people interested in plain language, you can join that and get more resources and news of plain language developments in Ireland from me and NALA. Okay, so that's kind of the introduction piece, folks. We're going to look at some examples now, and then we're going to get on to the break room. So what I use to help me out, folks, is something called the Hemingway Editor. So it's a free resource online. The Hemingway Editor, put into Google, and you'll get this readability checker, which will show you the grade score. So the grade score is just the reading level that the text is at, based on the length of the sentences, how many polysyllabic words, how many words have many syllables, the use of adverbs, the passive voice, phrases that have simpler alternative, and then long sentences. So, you can see here that these are very, very long sentences, and there are things in words that show this as well. But I like this because it's so color coded. Don't let it rule your life. If you have something that's like grade 10 and you want to aim it for grade 9, you're spend hours at it. Trust yourself that it's good. Okay, so just use it to help you. I use it a lot for showing the passive voice and long sentences. Okay, so readability checkers are out there. There's one built into Word, and if you just have to turn that on when you're using the proofing settings. Yeah, so those are the ones I recommend. So Word or and movie editor. Okay. What does it actually mean, the grade score? Well, it's based on the American system. So what you want to aim for is grade 8 or 9. This is easily understood by 13 to 15-year-olds. Using, saying that 13 to 15-year-olds can be a bit controversial because you don't want to sound like you're being patronizing. But that's the level you want to aim for. So a score of 70 to 60 or 8 or 9 grade. Okay. Great, folks. So see, the Harry Potter performs very well and the Harvard Law Review doesn't perform so well, but it depends who you're writing for. So folks, what happens when, good people are not so clear? Okay. So if you were to tell me what's the main message of this, or, is it easy to read or hard to read? So I'm just showing this briefly to show that kind of, less is more sometimes. The more you write, the less people will read. The more, things you want to put in, bells and whistles, the less people will actually take it in. So just kind of remember that, okay?
So to start with the overall experience of writing the blog, I guess to begin with the questions or the underlying ideas that were driving the approach I took. First question was, who am I writing for? So I'm aware that I'm much more comfortable writing in a very academic style for journals, for conference abstracts. That kind of style comes much more naturally to me. So that didn't fit and that didn't suit the blog. So that was the first thing I had to take note of, was this isn't the same audience. I'm writing for healthcare professionals. I'm writing for people maybe from the general public who don't have all the same specialist language, who don't use these words day in, day out. So it was just something I needed to keep in mind. The next bit was probably, what message do I want to get across? So as I think it was Lorcan had said earlier, you don't have to present all of your findings at every single time. You don't need to put everything out there. You can take a little bit here and there. You can present something in one blog and it doesn't have to be the entire research project. So trying to work out what exactly I wanted to say and who that was going to. And then how do I get people to read it? So again, it can't be really dense. It can't be really academic. It can't be, really technical. It has to look appealing. It has to sound appealing, and it has to be really easy to signpost. So those were kind of the things that were underpinning the start of my process. The things I learned about myself and my own style is I am much more comfortable writing in a passive voice, and it's maybe just the way that I've been, the way that I've been writing previously. But using I and we, and this is what we did, and this is how I did it, felt so unnatural, and it had to be something I was really conscious of when I was writing the blog. Had to completely remove all assumptions people knew what the specialised terms were and using them interchangeably. So is a hospice and a specialist palliative care unit the same? People may think that they're different or not understand the different words unless you're introducing every single one and explaining it appropriately. So try and pick a word and stick with it. I know my sentences are really, really long. So for someone who's on the web, who's reading something short and snappy, I really had to reduce the length of my sentences, and the same with my paragraphs. So there was no point rambling on and on because people aren't going to read it. And succinct headings as well. So I find headings really useful to break it up. Specifically for things on the web then, hyperlinks, I always just wrote click here and then put in a hyperlink afterwards. And actually reading through the guidelines, that was one thing that's highlighted, that the hyperlink should specifically describe what you're clicking on. So it was something I changed. And as well, the titles, it's not just about short and snappy and making something that's searchable in a search engine. It's something that draws people in. So it either tells people what to expect or what you're offering, or something that people want to know. Put like a main finding or something really interesting in the heading. It's not just about getting all of the words in that someone might search in a search engine. So that was a wee bit different for me as well. I think the last main one was the Hemingway app then. I found it really useful because it was good at highlighting the bits that I was writing passively. It was good at highlighting kind of the really long sentence structure. But the bit that challenged me then, I kept writing at grade 12 or higher, and it was saying to try and bring it back to about grade 9. And this was something then in the feedback with Sean, we were saying that actually grade 12 is okay as long as that's the audience you're going for. If you are going for a healthcare professional audience, or you're going for an audience, it might be okay, and it's not the be all and end all to spend hours and hours trying to reduce it from a 12 to 11 or 11 down to a 9. And just some of the reflections on today, actually, I found really useful. Sean, you had mentioned about, plain English isn't about dumbing down or being patronising. And it was something I actually really panicked about. And it was something that I was, it actually really worried me. It's like, am I making this too simple? Is this something that is going to patronize people? But actually, it's not making something accessible, is not being patronizing, and it's making it more accessible for a wider audience and actually creating more impact and a bigger reach. So if that's what we're trying to do, then surely that makes more sense. It's not patronizing people to be like that, and missing the meaning because it's too simple. Again, it was something I was worried about, but as I was writing, I realized that it is quite easy to get the message across in a more simple way once you strip it back and think, what am I actually trying to say? And, if I explain this to my mom or to my nanny, like, would they understand what I'm talking about? And I kind of have introduced that as part of my process. If I talk to them about it and they understand it, then I've gauged it at the right level. So I guess those were just my main takeaways from the overall process. It was really useful. It showed me that the bits that I wasn't as good at, and that was actually really helpful, that there are different styles of writing appropriate to different audiences. And I enjoyed that process. So I'm really grateful to the Institute and to Sean for giving that feedback. It was a really beneficial process. And I hope the blog at the end's, much more accessible and a better quality.